I'm Jerry Hesch from the Hesch Institute in Aurora, Colorado, and this is an example of someone who has a developmental asymmetry of the pelvis. And you'll find on the internet lots of conversations, lots of videos about aligning the pelvis, about asymmetry of the pelvis that's treatable, but this is an example of someone in which it is not treatable by any means of manual therapy, hands-on treatment. And in prone, our client has visual symmetry of the pelvis, and of course we can't see small differences, but gross differences you can see, and she looks symmetrical at the bottom and at the top of the pelvis. Now if you would lie on your back, please. Now she does have equal leg length. The right femur does appear to be a little bit more anterior than the left side, but there's no restriction of movement in the knee joint. We've already tested the hip joint and extension. There's no restriction there. And when we come on these bumps called the ASISs, I think the camera can easily see. Can you easily see that this right side is lower? And maybe that's better off from a pure lateral view. So this thumb is lower towards her feet. And this bump, the ASIS, is also more anterior. However, when we take up the slack and induce passive motion through that structure, it moves. So it is not based on a movement dysfunction that's treatable. It's based on developmental asymmetry of the pelvis. And what we found is that when she sits, the seating surface tries to force her body, force her pelvis into a position of symmetry. But again, it's developmentally asymmetrical. And so she experiences some sitting discomfort. And so we found that putting 3/8 of an inch lift under her left sit bone makes her much more comfortable in sitting. And if she presented with an anterior ilium based on the traditional definition thereof, a twist in the pelvis, then this movement would be blocked. But in fact, I can take up the slack, and after I take up the slack in the pelvis, then I can spring it and it bounces forward and it recoils. So again, because there's movement, it's not a treatable asymmetry, so we don't worry about that, but it is worthwhile to test that in sitting, and we ended up shimming under the sit bone. So that's it. Thanks very much.